Have you ever experienced something so traumatic that it felt like it shattered your world? Maybe you witnessed a horrifying event, survived a natural disaster, or served in combat overseas. Whatever the experience, it may have left you feeling anxious, fearful, and unable to move on. If this sounds familiar, you may be experiencing post-traumatic stress disorder, or PTSD. PTSD affects millions of people around the world, and while it can be an exhausting condition, it can be manageable. In this video, we'll explore what PTSD is, its causes and symptoms, and the different treatments available to help you manage your symptoms and reclaim your life. So, let's start exploring the world of PTSD together. In order to understand PTSD and its impact on the mind and body, it's important to first define what it is. PTSD is a psychological condition that can develop in people who have experienced or witnessed a traumatic event. Think of it like a psychological injury, similar to a physical injury you might experience after a car accident or a sports injury. Just as a physical injury can take time to heal, PTSD can also take time and support to heal. Trauma can take many forms, from directly experiencing it yourself to learning about a traumatic event that happened to someone else. When a person experiences trauma, their brain can become wired to automatically recall the event when similar situations arise. This can lead to distressing memories and images coming back into our mind, even if we're in a completely different environment. When we experience trauma, our brains go into survival mode, flooding our bodies with stress hormones like adrenaline and cortisol. While this response is helpful in the moment, it can also leave a lasting impact on our brains and bodies. People with PTSD may feel like they're stuck in this survival mode, constantly on high alert for danger and unable to relax. They may experience flashbacks, nightmares, negative thoughts, and other symptoms that can make it difficult to function in daily life. It's also important to note that exposure to trauma can come in many forms. Even exposure through media, such as movies or social media, can trigger traumatic memories and feelings in some people. To understand PTSD, it's important to note that it's not a sign of weakness or a character flaw. It's a normal response to an abnormal event. And it can happen to anyone who has experienced traumatic events, whether that actually happened to the person firsthand or simply being threatened by it. Examples of such events can include witnessing the death of someone, escaping from life-threatening situations, being involved in a serious accident, for example, a bike hit by a truck, or experiencing sexual violence such as rape or physical assault. So, what are the symptoms of PTSD? Well, they can vary from person to person, but there are a few common symptoms that people with PTSD may experience. Let's take a closer look. First, there's a pervasive mood called hyperarousal. This means that the person is always on high alert, as if their body is constantly preparing for danger. People with hyperarousal may feel like they're on the edge all the time, waiting for something bad to happen. They may get scared easily, even in response to normal everyday sounds like a car honking or a door slamming. Hyperarousal can also cause difficulty sleeping or concentrating. People with PTSD may have trouble falling or staying asleep, or getting restful sleep, because their minds are constantly racing. They may also find it difficult to focus or complete tasks, as their thoughts may be consumed with worries about the past or future. Another common experience with hyperarousal is feeling irritable or angry for no apparent reason. This can be confusing and distressing for the person with PTSD, as they may not understand why they're feeling this way. Others may also have a hard time understanding why the person is behaving this way, which can create further frustration and isolation. It's important to note that hyperarousal is a normal response to a traumatic event, but if it's interfering with daily life, it's important to seek support from a mental health professional. Another common symptom is avoidance. This means that the person may go out of their way to avoid anything that reminds them of the traumatic event. For example, if someone experienced a car accident, they may avoid driving or even being a passenger in a car. They may also avoid places or activities that could trigger memories of the event, such as a particular street or crossing. Avoidance can also take the form of emotional avoidance. The person may avoid talking about the traumatic event or their feelings about it, which can make it difficult for them to get the support they need. They may also avoid activities that used to bring them joy or make them feel connected to others, like spending time with friends or pursuing hobbies. Avoidance can be a challenging symptom to deal with, as it can limit the person's ability to participate fully in their own life. It can also make it difficult for loved ones to understand what's going on and offer support. The third symptom of PTSD is re-experiencing. This means that the person may have flashbacks or nightmares about the traumatic event, as if they're reliving it all over again. During a flashback, the person may feel like they're back in the traumatic situation, with vivid and overwhelming memories of sights, sounds, and sensations from the event. Nightmares can also be a distressing experience for someone with PTSD. These dreams can be so intense that the person wakes up feeling like they're still in the event, with a racing heart, sweaty palms, and a sense of panic. Re-experiencing can also take the form of physical sensations like sweating, a racing heartbeat, or even pain in parts of the body that were injured during the traumatic event. These sensations can be triggered by something as simple as a sound, smell, or sight that reminds the person of the event. Re-experiencing can be a terrifying and isolating experience for someone with PTSD. It can feel like there's no escape from the traumatic memories and that they're constantly being re-traumatized. The fourth symptom that we're going to talk about is negative changes in mood and thinking. These symptoms can greatly impact a person's quality of life. These changes can manifest in several ways. People with PTSD may experience feelings of shame or guilt and may blame themselves for what happened during the traumatic event. This can lead to a negative self-image, where they see themselves as weak, worthless, or flawed. They may lose interest in activities they once enjoyed and may feel a sense of apathy towards life in general. This can lead to feelings of boredom, emptiness, or lack of purpose. These negative changes in mood and thinking can have a significant impact on an individual's daily life, relationships, and ability to function. Fortunately, there are effective treatments available for PTSD. One of the most common forms of treatment is psychotherapy, which can help individuals learn coping strategies and process their trauma in a safe and supportive environment. Cognitive behavioral therapy, CBT, is a specific type of psychotherapy that has been shown to be effective in treating PTSD. CBT helps individuals identify and change negative thought patterns, manage overwhelming emotions, and gradually confront and overcome their fears. In addition to therapy, medication can also be used to help manage symptoms of PTSD, such as depression or anxiety. Antidepressants or anti-anxiety medications may be prescribed by a doctor and should be taken under close supervision. Also, many people find relief from PTSD symptoms through self-care practices like regular exercise, yoga, and meditation. It's important to note that treatment for PTSD is not a one-size-fits-all approach, and individuals may need to try several different treatments before finding the one that works best for them. With the right treatment and support, people with PTSD can learn to manage their symptoms and live fulfilling lives. To wrap things up, if you or someone you know is dealing with PTSD, you are not alone. It's completely normal to feel overwhelmed or scared, but there are people and resources out there that can help you. Whether it's therapy, medication, or simply talking to someone you trust, there are many effective treatments available that can help you manage your symptoms and live a fulfilling life. So don't be afraid to reach out for help, and always remember that there's hope for healing and recovery. You are strong, you are valued, and you deserve to live a life free from the weight of PTSD. Thank you for tuning in, and remember to take care of yourself and those around you.